So we're excited to have everyone and welcome back. So slides for today's session, as always, are available. We will post the link to those in the chat box. Towards the end of the call as well, we will be including a link for a brief evaluation. We really appreciate your feedback on these sessions because we want to make sure that the content we're sharing with you is what you need. And if it's not, we want to know that. So any ideas you have, things you're struggling with, please let us know, and we're happy to address any and all of those challenges. And the last thing is, for our call today, please use the chat box. If there are questions or comments or things that sort of resonate with you as you hear the content we'll share with you, include them in chat. Feel free to chat with us, to chat with one another. We want these to be engaging and interactive. So today we are joined by another Superior Health staff who is going to be discussing staff well-being and resiliency. So Dr. Yvonne Burston, and I will turn it over to her in just a minute. But before I do that, I wanted to follow up on a question that was asked last week about the twice weekly testing of staff who have not received their booster dose. So Kim, if you want to flip over to the next slide. And so I recognize that some of you may or may not have joined last week's call. For those who did, you will probably remember this question was asked of, do we need to do testing if staff haven't gotten their booster dose? So we just pulled together a few little tidbits from CDC and CMS and just wanted to put them all in one place to be able to answer that question. So last Thursday, March 10th, CMS actually updated their QSO 2038 memo, which did make changes to the routine testing cadence. So basically what this said is that facilities must now routinely test staff who are not up to date on their vaccines and at an interval that is dictated based on your county positivity rates. So let's unpack that a little bit. So what does up to date actually mean? And you'll see at the bottom of the slide there, up to date means that an individual has gotten all of the COVID-19 vaccines that they were eligible for. So minimally, this would be their primary vaccine series, and then once eligible, their booster dose as well. So when we talk about our staff being up to date, those staff who are up to date with their vaccines are exempt from weekly testing. And this specifically is related to routine testing, okay? So not testing for symptomatic employees or testing during an outbreak investigation. That's going to be different. This, again, is meant for our routine testing. So the routine testing would really apply for our staff who are not up to date. So that's the group that's going to require weekly testing. And then how often that testing needs to occur, again, is going to be dependent on our local transmission rates. So how do we know? So if you want to flip to the next slide, Kim, we put together a little table here that will tell you, based on your level of community transmission, how frequently that group needs to be tested. So community transmission levels are calculated using two things. The first is the number of new COVID cases per 100,000 people in the last week. And the second is the percent positivity for our nucleic acid amplification test for our NATs, those viral tests, again, also in the last week. So based on those two criteria, they are coming up with our community transmission levels. And depending on where you fall in that, your county will be assigned either low, moderate, substantial, or high transmission rates. And within each of those, there is an associated testing requirement. So for our low community transmission group in blue, you will see that screening and testing on this sort of regular routine basis is not recommended regardless of vaccination level. So even if they're not up to date with their vaccines, routine testing is not required. As we move into moderate and higher, there is going to be testing required. So for moderate transmission, it would be once a week. And for both our substantial and high community transmission levels, this would be twice a week. So understanding your community transmission level will be very important. So now you're probably thinking, okay, how do I figure this out? So if you flip to the next slide, Kim, this on the CDC website, and there's a link at the bottom. Again, these slides are available, so you'll be able to click through these hyperlinks. But all you have to do is enter your state and then your county. What you see here is where I currently live. And it will, this page, once you plug in that information, it will give you lots of details. But if you kind of keep scrolling down this page, you will be able to see a map, which is displayed on the next slide. And this will highlight your county, and it just gives you a little text box that'll pop up and say, you know, here's your county. For me, it's Kalamazoo County. It gives me the transmission level, which is also color coded, and this color coding matches that chart we saw on the last slide as well. And so this would then tell you, okay, so if I'm at a substantial transmission level in my county, that means any of my healthcare workers and staff who are not up to date with vaccine need to have that viral test twice a week. And so again, would just encourage you to monitor this, keep an eye on it, look at it, understand what your transmission level is so that you can make sure that you are testing those staff who are not up to date in accordance with what their transmission level is. So hopefully I've helped clarify that a little bit and provide some more guidance and framework around that. As I mentioned, all of the links are in the slides, so feel free. I know Jerry dropped the link to the slide deck in the chat box. Pull up the slides, click on that, enter your county and your state and see where you're at. Compare that against what your current screening and testing looks like, and you may be able to, kind of pare back some. You might have to ramp up more. I would hope that, through this series and through the ongoing work that you and your teams have been really aggressively doing, that we are sort of at the tail end, and hopefully people are up to date with their vaccines. We know that is not always the case, but that's certainly what we're here to help with. So any further questions on that, please drop them in the chat. But at this point, I would like to hand the floor over to Yvonne Burston to talk about staff well-being and resiliency.
Thank you, Kelsey. So today we are going to look back to when COVID first arrived and the issues experienced by staff that may have contributed to their work-related stress. We will review some of the possible causes of mental exhaustion and look at interventions to help with mental stress and anxiety. Additionally, according to the CDC, we will look at the current variant of interest. Lastly, we will look at the available boosters and resources to help with mental exhaustion. Next slide. I want to share concerns with mental exhaustion among healthcare staff, the previous causes, and according to Hong, the nursing profession is known for having high levels of occupational stress and burnout. Unfortunately, mental exhaustion can cause an emotional toll. Owens 2020 contends that 50% of healthcare professionals described feeling depressed. 45% had feelings of anxiety. 34% suffer from insomnia, and 72% suffer from other psychological distress. Next. So let's look at what we saw during the look back. During the start of coronavirus, nurses and healthcare professionals have found that they were in uncharted waters without any experience or knowledge regarding the care of patients affected by the virus. The already growing shortage of nursing professionals became fearful and significant concerns because of the lack of personal protective equipment, among other problems. The shortage of PPE added to stress and anxiety experienced by nurses and other healthcare professionals. The nurses For many nurses, the commodity of PPE is considered a basic need in delivering safe patient care. Many staff regard PPE as a safety measure. The measure assures the safety of both the patient and the healthcare worker. When we look at Maslow's hierarchy of need described after psychological conditions, safety needs dominate behavior. The need for protection in Maslow's hierarchy of needs is also expressed. The feeling of being unsafe is a probable explanation of why the public and the healthcare community were fearful during this time. The shortage of PPE and lack of understanding added stress and anxiety. Unfortunately, an appraisal of healthcare resources concerning PPE moved decisions from evidence-based practice, which is what nurses work on, evidence-based practice, to resource-based views, which added to stress, strain, burnout, and already mentally challenged staff. Next slide. The healthcare professionals should be concerned about unhealthy staff as they are experiencing challenges, decline in their mental health. And this has affected retention rates and become a problem. Consequently, our patients will ultimately suffer. Therefore, the healthcare professionals' mental health is of great concern. Unfortunately, their mental health has taken a back seat during today's fight with coronavirus. So you say, Dr. Burston, where are you getting this information from? Well, I've checked with several nurses and talked to them, and nurses have already, or the healthcare professional has already felt that they are not able to express feelings of exhaustion. They're not able to talk to anyone about feelings of mental health. They are considered the ones who take care, so they can't go see their physicians, they can't go see their mental health provider because they're having issues, because they need to take care of others, and especially now during the coronavirus, they need to take care or be the strong person. And this has caused an even higher issue, more of an issue for the staff than before. Next slide. So, how do we reduce anxiety caused by COVID-19? According to the nonprofit mental health and wellness website, helpguide.org, stress is your body's way of responding to any demands or threat. When you sense danger, whether it is imagined or real, the body defenses kick into high gear in a rapid automatic process known as stress response. Your workplace team is dealing with many stressful situations and have many questions. How do we handle having our kids out of school? How can I best care for my ailing parents? Should I leave home to go to the grocery stores? These are important questions. All of these impact their well-being and their performance at work. Next slide. One of the most challenging parts of this crisis is feeling out of control. To reduce this, make all aspects of work feel precise and controllable. The means over communication, this means over communication with your staff so they have the answers they need. Make it clear and easy for them to find the information and support they need, including access to mental health support through EAP programs and access to others who can help them as well. Next slide. So when it comes to training and education, discussions could include the possibility of frontline stress control teams, appropriate work rest schedules. And so what I've seen is nurses may, or healthcare staff may be required to do overtime, but they're not required to stay home that same length of time. So we want it to be appropriate or balanced out, and to support for the needs of providers or family members. There are specific sources of stress for healthcare workers treating patients with COVID-19 virus. The stressors include fear, loneliness, unanswered questions, and even death. And not many of us have had so many deaths at one time, but the healthcare workers, especially those in the nursing home, have people that they've dealt with for years that are now gone because of this situation, or that's always in their room and have not been able to come out because of this situation. So we want to make sure that we're looking at and hearing the concern of our staff member. Next slide. So we want to look at consistency. Establishing routine is essential. Consistent assignments is the practice within long-term care, and most facilities have this, by which care staff work with the same residents almost every shift for an indefinite period of time. Consistent assignment is considered by many to be essential to person-centered care. If you had an all-hands meeting every Monday at 9 a.m. to keep them up with what's currently going on within your facility, that's another way of being consistent. Just letting your staff know what is going on and what they can expect. Next slide. We want to make sure that your staff feel heard. Ask them what they need and how the organization can help them be more successful. Get answers to their most stress-inducing questions and make those answers visible. Create a list of the top things they're concerned about and address them. They need to know that someone in charge has their back. Next slide. And so some quick stress reducing tips. Exercise has been shown to lower cortisol levels in your body, and it's a great way to get your mind off of intrusive thoughts. Unwind near bedtime with an easy jog, a long walk, or a relaxing yoga sequence. Mindfulness means being aware and present at the moment, simply focusing on the moment rather than in the future or the past can help reduce stress by breaking you out of a cycle of disruptive thinking. Thinking positively, sometimes the simple act of writing something down can significantly affect stress. Spending time with pets, loved ones, and close friends have been shown to reduce stress significantly. The physical act of laughing has been known or shown to reduce stress. Even something as simple as a broad smile can signal your brain that it doesn't need to be on high alert. And those are the tips. And there's a link there for you to go to those particular tips. The next slide. And so we want to look a little bit on the COVID-19 variants of interest. The European Center for Disease Prevention and Control regular accesses new evidence of variants detected through epidemic intelligence, rules-based genomically variant screening, or other scientific sources. And so you'll see the first one, which was Delta, was first identified, although most people think it was in China, it was actually in India. The Omicron was first identified in South Africa, and now there's a new part of Omicron, and that one is the BA2, and that one was first identified in the Philippines. Next slide. And then now we're looking at the boosters. There are 3 boosters. 3 COVID-19 vaccines are authorized or approved for use in the United States to prevent COVID-19. So then you have the Pfizer or Moderna vaccine, and then you also have the Johnson & Johnson vaccine as well. And we have a link here to find vaccine providers. Next slide. And these are some resources for some of the information that was given during the slide. And that's going to be it for me today. Thank you.
Thank you so much, Yvonne, for providing that helpful feedback. And I think, you know, hearing some of these tips and just reminding ourselves of all the hard work that we've done over the last 2+ years, and just taking a step back and recognizing that people are tired, people are mentally exhausted, physically exhausted. You know, you are struggling with staff shortages and figuring out how you're going to run and operationalize, you know, your facility and care for your residents. And that burden is just so heavy. And on top of all the other regulatory things that you're dealing with, and, you know, your own personal lives and home lives and kids and spouses and, you know, keeping everybody healthy, it's a lot. And it's a huge burden and weight. And I think you've provided some good tips and things for us to think about as we move forward in this weird new COVID, post-COVID world, if and when, you know, we ever get to sort of what is being referred to as that new normal. One of the things that really stood out to me as you were talking, and I want to just pose this question to the group, is about mindfulness or writing. And I'm curious, for folks on the line, are there any strategies that stood out to you as Yvonne was talking about stress reduction tips? Is there anything from that you've done in your facility or other things you've done? And the reason I pose this question is because I would love to hear what things each of you are doing in this space for either your leadership team, for your staff, for your residents, or even just for yourselves. And this also could be something that, you know, you can learn and hear what others are doing and maybe adopt something new. So with that, I will pause and just open for discussion or any questions or feedback on that. So what have you done around strategies for stress reduction in your facility? And there's no right or wrong answer, so don't be shy. So while people think about, you know, what things they might have done or shared with staff, you know, one of the things that we have done at my organization is a concept called 3 good things. And I think this really helps shift our mindset from all of the heavy, all of the really hard burdens, the things that we carry, and really just shifting that focus to the positive. And so what this might look like in practice is, you know, after a really long day or a really hard shift, instead of dwelling on everything that went wrong and how bad of a day it was, what are 3 good things I can pick out from that day? They might be small things. They might be, I was able to catch up with somebody at work that I hadn't seen in a while, or I sent a message to a friend that I had been thinking about, or I got to take my dog for a walk. I got home from work before it was dark, right? So any of the things that might be small, might be trivial, but just reshifting our focus to think about and look at and try to search for what is the good, where can we find it, and really trying to get into a better mindset. So that's just one example I can share, but I don't know if that rings any bells, or if others have examples similar to that of mental exercises that they've done either with themselves or in their facilities.
Kelsey, if I can just make one suggestion for the nursing home administrators and nurses. This was a study that I actually did, and 100% of the nurses that completed their survey felt that they were not able to actually talk to administration about their mental wellness. And so when you're asking questions and trying to pull things from the staff, it would be interesting to find out if your staff even feel comfortable with talking to you about their well-being, and then finding out what type of things you can put in place at your facility.
Absolutely, and I think that's a great point to keep in mind too. Just as a collective society, right, we work to sort of combat the stigma of mental health or taking a mental health day, particularly when we're so short-staffed. We have so much work to do, and it's just that burden just feels consistent and extremely heavy. I do see a comment in chat from Rita that they've been letting pets into the facility. I think that's pet therapy is a fantastic way to put smiles on people's faces and just kind of lighten the mood. So I'm glad to see that you've been doing that, Rita. I'm sure both your staff and your residents alike have been enjoying that bit of sunshine in the day. All right, I think everybody's had lunch and is tired. So it's a quiet bunch, but thank you so much, Yvonne, for coming and sharing some of these tips with us. As always, we hope this has been really helpful for you. And then just a final reminder, the link to the slide deck for today, as well as the event survey, both of those are posted in chat. So take a minute and click on those so you can download the slides and take a couple minutes to complete the survey. Our session for next week, we are actually going to be joined by the team at Medalodge of Rochester Hills, and they are going to be talking a little bit about their nursing home story related to vaccinations and boosters. So with that, we look forward to seeing you all back next week. Thank you for your time and your participation. And until then, thank you for all the work that you're doing, and stay well.